See, this is the cranial cavity having anterior cranial fossa, medial cranial fossa and posterior cranial fossa. Anterior cranial fossa, what we are going to explain now, we have cranial nerves, 12 cranial nerves, and how exactly they are entering in or out from this cranial cavity. So this is the cribriform plate of the ethmoid bone, where we have the passing of the olfactory cranial nerve. Then the second one is this is also another specimens where we can see the cribriform plate of ethmoid bone, where we can see small foramen from where we have the olfactory nerve passing. Then we have the optic canal. This is the optic canal over here. This is the optic canal. So here also we can see this is the optic canal. Although this bone is not good at all, this is the optic canal where we have the optic nerve is passing. So this is the orbit also. We can see this is the orbit. This is the orbit. We have superior orbital fissure, inferior orbital fissure, and here, although it's not prominent, this is the optic canal. Okay, the second cranial nerve is passing. Then we have the third cranial nerve is the oculomotor, that is the superior orbital fissure. Superior orbital fissure that we can see by this specimen. Yeah, this is the superior orbital fissure. This is the optic canal, and inferior orbital fissure is not prominent. This is the optic canal, superior orbital fissure. So from the superior orbital fissure inside we can see this is the superior orbital fissure inside the cranial cavity, this one and this one. So from the superior orbital fissure we have the cranial nerve, third oculomotor, fourth is the trochlear and trigeminal nerve, okay, ophthalmic divisions of trigeminal nerve, and also sixth cranial nerve, that is the abducent. Okay. So what about the maxillary and mandibular divisions of trigeminal nerve? Maxillary divisions is passing just superior orbital fissure se niche we have the foramen rotundum. This is the foramen rotundum. So from here we have the maxillary nerve and then the foramen ovale. From here we have the mandibular nerve. See this specimen. So this is the foramen rotundum and foramen ovale. Take a foramen rotundum we have passing of the, this side is clear, foramen rotundum having the maxillary nerve, and foramen ovale we have the mandibular nerve. This is the foramen spinosum. So we have three foramen: superior orbital fissure, foramen rotundum, foramen ovale and foramen spinosum. Foramen rotundum having the maxillary nerve, foramen ovale mandibular nerve. Now 7th cranial nerve and the 8th cranial nerve. 7th is the facial, 8th is the vestibulocochlear. This is the internal acoustic meatus. So through this foramen we have the facial nerve and vestibulocochlear nerve. 9, 10th and 11th. Just below the internal acoustic meatus we have the jugular foramen. So from this jugular foramen we have the 9th, 10th and 11th cranial nerve. And now below we have the hypoglossal canal, the 12th cranial nerve. Now see this specimen. This is the internal acoustic meatus, and here we have the 7th and the 8th cranial nerve, and this is the jugular foramen. Through here we have the 9th glossocranial, 10th vagus and spinal accessory 11th cranial nerve. And after that this small foramen, what we can see here, the condylar foramen, this is the occipital condyle. So this is the hypoglossal canal. This is the hypoglossal canal. Through that we have the hypoglossal nerve.